Good morning to everyone. So this is my disclosures. So recently, metabolomics analysis enables the detection and semi-quantitative measurement of unique metabolites from a broad range of metabolic pathways. And then we can detect the metabolites. These approaches can detect the metabolites associated with pathophysiological states. So focus on the pathogenesis of OAB, multiple factors, including prostate hypertrophy, metabolic syndromes, are associated with symptoms. However, detailed etiology of OAB remains unknown yet. So this study focused on identify metabolites from a metabolic approach, and we investigate association between the metabolites and OABs. So a total of 47 male participants with an apparent neurological disease at our outpatient clinic were enrolled in the present studies. Mean age and BMIs were 71.5 years old and 23.0. A 24-hour bladder diary, IPSS, and QOL score were carried out, and blood samples were also collected for metabolic analysis. OAB group defined as a 2 and more in the urgency score of IPSS, and the patient with a 1 and less belong to a control groups. So this is a result of data in the 24-hour bladder diaries. Nocturnal urine volume, 24-hour micturition frequency, nocturnal micturition frequency, and the nocturnal index was significantly higher in the OAB groups. On the other hand, maximum void volume was significantly less in the OAB groups. However, 24-hour urine volume or nocturnal polyuria index were not different between the groups. So, metabolic analysis identified 79 metabolites from plasma of the patient. In the total of these 6 metabolites, there was significant difference or trend of difference between the OAB and control groups. We did a multivariate analysis which showed the increases of these fatty acid and decrease of cholic acid were significantly associated with the OAB. And then decrease of deoxycholic acid was, also could be associated with OABs. So this is a hypothesis from our studies. Bile acid is known to be associated with glucose, lipid, and energy metabolism through these signal pathways. So decreases of bile acid could be associated with metabolic syndromes. And then increases of fatty acids are also associated with metabolic syndromes. So we consider that abnormality of metabolism of bile acid and fatty acid could be one of the etiology of the OABs. So in conclusions, OAB in the males could occur through the abnormal metabolism of fatty acid and bile acid, which could be associated with the metabolic syndromes. So further studies using metabolic analysis have a potential to detect new biomarkers and develop potential targets for new treatments. Thank you for your attention.
Open for questions?
Were the size of the prostate, flow rate, and post-void residue comparable in the two groups? In other words, was there any effort made to exclude bladder outflow obstruction as a confounder?
Okay, thank you for your question. So we didn't check the prostate size for all patients, but patient with data of prostate size, so we checked it, but we didn't have any correlation between this kind of abnormality of bile acid and fatty acids. That's our conclusion.
Do steroids have any effects on the fatty acid production? Because we know in metabolic syndrome, when it's associated, and it's very commonly associated with a change in corticotropin releasing factor.
Yeah.
So are any of these bile acids associated with or affected by steroids?
Well, thank you for your questions. But I think it's a very difficult question for me. So maybe absorption of the bile acid is different in a patient with OAB and metabolic syndromes. So it's hard to say, but I think maybe fatty acid. We already know that increases of fatty acids associated with metabolic syndromes. But now we also focus on bile acid. For some treatment for metabolic syndromes, maybe I think we need to concentrate to increase absorption of the bile acid. Maybe one of the treatment of metabolic syndrome that may affect the OAB symptoms. So it's an
the other
answer for you.
question I have is, we know that the microbiome in the gut now has been associated with obesity. Right?
Yeah, right.
So did you look at, or do you plan on looking at the microbiome in these patients and its effects on the bile acids?
Yeah, that's a question. That's the next step of our studies. So we also thinking about the microbiome in the intestines. Maybe that may affect the absorption of the bile acid. Yeah, thank you for your questions.
Great. That's all we have time for questions. Thank you so much.
Thank you.
Appreciate it.